As lead cancer allied health professional for cancer services at Salisbury Hospital, I support dietitians, physiotherapists, occupational therapists and exercise instructors in how we can best support patients with cancer who are receiving treatment at Salisbury Hospital. Patients that would like to access cancer therapy can either phone us and give a self-referral on the phone, or they could contact their clinical nurse specialist, cancer support worker or consultant and ask to be referred to our service. When patients first are referred to our service, we will normally phone them to have a conversation and find out really the best person to see that patient. So it might be a physiotherapist, exercise instructor or occupational therapist. We would then see patients face-to-face, usually for the first visit, and have a discussion, what matters to them, what's important, what are they struggling with, and how may we support them with their goals and their journey.
If I had to sort of say to anyone who was getting a diagnosis now, I would say you are not on your own. All the services are there. Just ask the question. Don't be frightened to ask the question. No question is too big or too small, and just they were fantastic for me, they were fantastic for my family.
As an occupational therapist, I support patients with cancer, and my role is to assess the impact cancer has on their everyday lives and, importantly, work out what matters to the patient and to support them in regaining their independence and their functional activity. An OT will also support patients with symptoms from their cancer treatment, which may include fatigue, pain or sleep, which may be interrupted. An occupational therapist will also signpost you to other services and support groups in your local community. And importantly, an OT will help a patient identify what's really important to the person and identify rehabilitation goals so that a patient is able to identify what really matters to them. And when an OT sees the patient, it's an opportunity to complete a functional holistic assessment to be able to identify with the patient what's really important to them, what their goals are, and importantly, how they want to maintain their function and their quality of life.
A physiotherapist can help support cancer patients in a variety of different ways. One way is before treatment starts. So if a patient is struggling to get the idea of how to exercise and looking to increase their fitness prior to any treatment they're due to receive, whether that be surgery or chemotherapy or radiotherapy, we can advise them on how to increase their fitness in a nice and controlled way. Any other symptoms which is kind of making getting back into exercise a bit more difficult. We can then give them programs to help with that, advice on how to build that physical fitness over a good period of time so that they're in a better place before they have their treatment. That then can carry on through their treatment, so helping them maintain that level of physical activity so they can minimise the effects of any symptoms they get and hopefully get the most out of the cancer treatment they're receiving. So we talk about rehabilitation, and what we can do is help them get back to the activities they would like to get back to. And that can be anything. So it doesn't have to be sport, it can be just daily activities, it can be gardening, it could be walking the dog. If those are things that they're struggling with, anything that gives their life some meaning and they're struggling to get back into, we can help them get back into that. When we're dealing with people who are feeling quite high levels of distress, again, what we'll do is take a period of time to actually talk those over. All the staff in our team are level 2 psychology trained, so we're in a better place to have a good conversation and really listen to the concerns of people and work to allay those fears if we can do. If they're not within our ability to allay, then at least then maybe put them in touch with the right people who can allay those fears. And that's where we would reach to the sort of wider team, with the wider team that work within cancer, whether that be the clinical nurse specialists, the doctors, the psychologists, the cancer support workers, the dietitians, other professions that work within this area. We'd reach out to them so they can have those good informed conversations and hopefully put a patient's mind at ease.
People are very stressed at this time, and obviously we want to make it as easy for people as possible. So we do have several offers to make it easier. We provide physiotherapy clinics rurally at Shaftesbury and Warminster. We also have an exercise group which meets at Wiley Village Hall. So this is basically bringing care more out into the community for patients to access rather than having to come back to hospital for care.
I'm one of the exercise instructors and I'm part of the cancer therapy team. My role is to support patients to improve their fitness and activity levels in preparation for medical treatment or surgery. Following on from this, when the patients are ready and it's safe to do so, we also support them after treatment or surgery for rehabilitation. We do this through working one-to-one with the patient and establishing realistic goals, and then we put progressive measuring steps in place as a way of working towards and achieving these goals. This could be through creating a tailor-made gym program, it could be creating a home workout program, or just encouraging like swimming or other classes that might be based in a leisure centre. We will also talk about their hobbies and what they get up to on a day-to-day basis, as this can be a really good way of implementing exercise into their normal day-to-day life and also doing things that they enjoy doing. They will also have the option to use a gym, swimming and other class-based exercise sessions, and we can even provide a leisure centre pass to make it financially feasible for them, and this is funded by the Stars Appeal.
I was diagnosed in July 2023 on my wedding anniversary, and I was in the Cotswolds on holiday, which wasn't a nice thing to happen there, but never mind. And then I had my surgery in the August, very quickly, and then I followed that with radiotherapy in the October. And then you get to after the surgery and you think, what's next? And then you have the treatment, and then you think, right, now I'm going to be okay. And you don't know all of the things that are going to come along. I call them who knew moments, because you just think, well, I never knew that was going to happen. And then there was a little brown envelope, which I remembered that Megan, the support nurse, had given me from Macmillan. And I thought, oh, what's in there? It's just a brown envelope. And I opened it, and there was 2 cards in there, 2 little A5 cards that were bright blue and bright yellow. And they were hope. One of them was the wellbeing group, and the other one was free swimming. I spoke to Carl and booked myself an induction, and I came along and I have done my 12 sessions. But after the first one, I knew that I would love the gym. That I said I was never going to do, and I absolutely love it. And my husband said that after I'd attended, he said he'd got his wife back.
Obviously working with people with cancer can be quite hard going. Listening to their stories and what they've been through can be really, really hard. But when they come in and I meet them and they leave and they're much happier than what they were when they come in, that makes it really motivating. And seeing their progressive steps over a period of time, it's always nice, it's really rewarding.
Well, I was first diagnosed in December 22. After a CT scan, it showed that I had bowel cancer. I thought it was going to be quite a quick process, be back up on my feet in a few weeks' time kind of thing. He explained it was going to be a simple operation, a resection, no need for a stoma bag, which I was quite relieved about at the time. Played a lot of sport all my life, so very fit, I'd say, for my age. And it was just on one of my colorectal follow-ups, really. I was asked how things were going, and I just said, I just feel as I've hit a brick wall. My fitness doesn't seem to get any better, I don't seem to get any stronger. And she just said at the time, have you heard of the wellbeing group? And I said, no, what is it? And she explained to me quite clearly what it was. And also it was a gateway to a 12-week session in a gym. And of course, my eyes opened up. I thought, this is going to be good for me. This is exactly what I need. So then that led to a meeting with a guy from the Cancer Rehab Physio group. Spent a good hour with him, very informative, made me feel comfortable, explained a lot of things, listened to me. Now that's led me on to another exercise group, which I go to weekly, which I'm finding a huge benefit. And hopefully then I'll lead on to the 12-week gym session.
The feedback we've received from our patients really around is they felt listened to. They felt that we were able to provide treatment and care specific to their concerns and their needs, which is really important at such a challenging time. patients reported they felt physically much more active thanks to the support they've received, and also through the prescription of equipment, people felt able to function better and made life a bit easier for them at home. Working in cancer services with these patients is a privilege, I would say, because we know it makes a difference, and that it's a huge amount of job satisfaction to make a difference to people at a time when they're really finding life tough.